Okay, so here we are in Malawi. I thought before we left that maybe we should put together some little kits of healthcare stuff. We're actually here to investigate maternal health in Malawi, and I thought while we are visiting some of the healthcare centres that we might take some of the essentials that in Australia we take for granted, things like paracetamol, antiseptic wipes, soap, thermometers, band-aids. Again, so many infections are caused by lack of care, antiseptic wipes and band-aids. Simple, we have them in Australia. Here, it's not so common. So I'm going to put together a few bags. Well, day one, we're on the road in Malawi, very excited, and we have with us Regina, and Regina is the Health and Nutrition Manager for World Vision. Yes. Can you tell me what some of the maternal child health issues that you see here in Malawi?
Here in Malawi, we see what worries us most is nutritional deficiencies, because when a mother is malnourished, normally we see the cycle going on. The child also becomes malnourished. We have very high mortality rates. For children, we are, I can't remember exactly, but for under 5 mortalities, we are above 100. And for infant mortalities, we are around 74.
And per how many births?
Per 1,000 births.
So every 1,000 children that are born, 100 will die?
Yes, over 100. I think it's 134.
That's just...
Yeah.
Can you explain where we're going today?
Today we are going to Doha. We call it Doha.
Doha.
D-O-W-A.
Doha.
This is a district hospital.
Have a look.
Yeah, no problem.
So Dan, can you tell me this healthcare centre, how many people do you look after in this healthcare centre? How big is the district?
Yeah, for the population is 15,996.
And you look after all of them?
That's it.
Okay. So in a day, how many people would you see?
For the OPD, at least an average 120.
120 people. How many people have you seen this morning?
This morning about 80.
About 80 people. And
Yes.
you're the only doctor here?
No, of course we have 3 nurses.
3 nurses, and you're a midwife?
Yes.
So what happens in here, Dan?
In fact, for example, maybe the woman is 9 months. So we advise them to come here to wait labor.
So they wait in this room?
Yeah, in this room, of course.
And what do they do?
For the only, maybe they have their kitchen or their mats.
So they sleep here?
They sleep here. If labor starts, then definitely we take them into the labor ward.
And we can see that, we can go into there as well. And how many women do you have in here at the moment?
So far there are 26 antenatal.
26?
Yes.
And they are all waiting to give birth?
That's it.
This is the labour ward. You only have 2 beds?
Yes.
And if more than 2 women come in here, they give birth on the floor?
That's very true.
And you have no electricity?
We don't.
So at night time, how do you light?
Yeah, sometimes we have a very small solar panel, but as time goes, it goes off.
Goes off.
Then we use sometimes a lamp, or else if the fuel is not there, we use a torch or a candle.
A torch?
To conduct a delivery. So it's very difficult.
Okay, and you have no running water either?
Sometimes the woman, maybe who have just given birth, the guardians will go maybe about 2 kilometers away from this place to draw water, and then
they fill it up in here?
Yeah. When we want to use the water, we definitely use this water.
Okay.
Maybe after delivery, when we want to wash hands, we use the very same one, not from the taps.
No.
But from that.
Because the taps aren't working?
They're not.
And all you need is a pump to make the taps work?
That's it.
How much is a pump?
Oh, we don't know.
Okay. Did you deliver this baby?
Yes.
Yes?
Yeah, in the morning hours.
This morning?
Yes.
Oh, this baby was just born this morning. Oh no, stay. Is this a little boy or a little girl?
Oh, come on.
Oh, he's been taken from his mama.
Oh.
Oh.
Yes. Wamuna baje?
Boy? Girl?
Yeah, it's a
Little boy?
It's a boy.
Was this your first baby?
Mwana no yamba wajiwiri.
The
The third boy.
third boy?
Yes.
Ah, he's beautiful. Did she have to travel far?
Mwachokera kuti baje? Kalulu, almost 13 kilometers from this
13
place.
kilometers.
Yeah.
And she walked, or she was here already, or did she walk when the labour started?
Usiku, yeah, she walked and then she was here for antenatal waiting in labor. But she was
she here,
walked
right.
when she was coming from home.
Okay. Oh, he's beautiful.
Good.
And if you ever had a situation where there are too many women giving birth,
Yes.
where do they go then?
Definitely, we always keep them here.
Keep them here.
Yeah.
So you just find room somewhere to
That's
put
it.
them.
Yeah.
And what would you like to see happen to the conditions here? How would you like to see them improved?
Maybe on the condition of the accommodation, that at least we should need to have the labor ward that is a little bit bigger. Maybe can accommodate maybe 10 beds, so that at least by the end of the day, we can conduct maybe 10 patients.
Visiting the hospital today and meeting people like Violet and Dan, who are just so courageous and so incredibly good-humoured considering what they have to deal with on a daily basis. The fact that Dan saw 100 patients before lunchtime in itself is just awe-inspiring. That he delivered 7 babies in the night and then another 2 in the morning. He didn't sleep, and yet he was still so enthusiastic and showing the conditions that he's working in. Having a child myself, I'm saddened but inspired, and I really want to try and do as much as I can to help.